Welcome to the Omni Dental Podcast. Trying to figure out the best way to, replace missing teeth or maybe stabilize dentures, it can feel like wading through just tons of clinical jargon. You hear about traditional implants, bone grafts, mini implants. It's a lot. Where do you even begin? That's exactly why we're here today. We're doing a deep dive, really digging into the source material provided by one of you, our listeners. And the focus today, it's squarely on mini dental implants, MDIs. The pros, the cons. Our mission is pretty clear. Cut through the hype, understand the actual technical trade-offs, and figure out, well, where do MDIs really fit in today's dentistry? Okay, let's unpack this.
Yeah, it's a really important topic. MDIs, they represent a genuinely different approach for certain situations. The sources we looked at define them clearly. They're basically smaller versions of regular implants, sometimes called slim posts.
Slim posts, okay.
Right. So while your traditional implant is, thicker, robust, MDIs have a much smaller diameter. And that size difference, it's not just about looks, it's fundamental to the surgery. Their main job is really twofold. Yes, they can replace a single small tooth, like maybe an incisor, but where they often really shine, and what gets a lot of attention, is stabilizing dentures, locking them down, which honestly can be completely life-changing for patients struggling with loose dentures.
Okay, so that size difference, the smaller diameter,
Yeah.
that seems like the core thing here. If they're slimmer, I assume that means they need less bone around them to hold,
That's exactly it.
which right away sounds like it solves a huge problem for people who've been told, sorry, you don't have enough bone for standard implants.
Precisely. That's the key technical consequence. Because they're smaller, placing MDIs often lets you skip the bone graft procedure entirely. That complex, sometimes lengthy process needed for traditional implants if there's bone loss. The MDI surgery itself is just less invasive, less drilling, less disruption to the gum tissue. We're talking the difference between a treatment plan that stretches over months versus potentially a same-day solution for a lot of people.
Wow, okay. Just hearing that makes MDI sound incredibly attractive right off the bat. I mean, for someone weighing their options, the idea of faster, simpler, that's got to be compelling. Let's zero in on those advantages then. The parts of the sources that really make you sit up and take notice. Here's where it gets really interesting.
Well, the sources basically highlight four main upsides. First, as we said, the procedure itself is just dramatically less invasive. Think shorter surgery time, which naturally means quicker healing.
Yeah.
Most patients, honestly, are back to their normal routines without major pain, often within just a day. That's a huge plus for anyone anxious about recovery time, taking time off work, that sort of thing.
And that speed links directly back to the bone issue we mentioned. So for patients who have maybe mild, maybe moderate bone loss, not enough for a standard implant, but not, completely gone, MDIs often mean no graft needed.
Correct. The graft is often unnecessary in those cases. And that accessibility factor is massive. It opens up smile restoration to people who maybe couldn't qualify before, either due to bone density or perhaps other health issues that make major surgery risky.
Okay, accessibility is key. What else?
Then there's the immediate results aspect, what's often called same-day function. You can potentially get MDIs placed to stabilize that tricky lower denture or even replace a small front tooth, all in one well-planned visit.
So you walk in with the issue, walk out with solution.
Pretty much. You walk out with restored appearance and immediate function, though you'd obviously need to be careful with chewing initially. But that instant boost in confidence, the sources really emphasize that again and again.
Makes sense. And the final big pro, I'm guessing cost.
You guessed it, affordability. Because the whole process is simpler. Fewer materials needed, less time in the chair, fewer appointments overall. They generally cost significantly less than the conventional multi-stage implant route, especially when you factor in that separate, often expensive bone grafting surgery that traditional implants might require.
Okay, so summarizing the pros, faster procedure, less invasive surgery, often no need for bone grafts, making it more accessible, potential for immediate results, and lower cost. Sounds pretty good.
It does sound good. That's the perfect summary of the advantages, but this is where the deep dive part comes in, right? We have to think critically. Because the very thing that gives them all those benefits, their smaller size, inherently introduces trade-offs, specifically around strength and longevity. If we connect this to the bigger picture, we really need to talk about durability and managing patient expectations.
Okay, I'm going to jump on that immediately. If the implant is smaller, how does that actually affect how well it locks into the bone that osseointegration dentists talk about? And how does it handle the constant pressure of chewing?
That is absolutely the crucial question. Because there's less surface area physically interacting with the bone, its ability to withstand heavy, constant forces, especially chewing forces, is less than a standard implant.
Right. Less surface area, less grip, basically.
Exactly, and that's the key limitation. MDIs just aren't built for replacing big back teeth, the molars that do all the heavy grinding, or for areas under really high stress. They perform best, really, in the front of the mouth for single teeth, or as those denture anchors we talked about, where the forces are generally lower.
So if they are inherently not as strong, that must directly impact how long they last, right? What do the sources say about lifespan?
Yeah, that's the major trade-off. Conventional implants, when done well and cared for, can reliably last for decades, 20 years, maybe more, sometimes even a lifetime. MDIs, on the other hand, generally have a shorter expected lifespan. The estimate you see most often in the sources is somewhere in the range of 7 to 10 years or longer, assuming really meticulous care by the patient.
7 to 10 years.
Okay.
That's a significant difference.
It is, and it's probably the most critical piece of information for someone thinking long-term, especially financially.
Okay, let's pause on that financial aspect right now because that seems really important. If you get a traditional implant, say at age 50, maybe it costs $5,000 but lasts 25 years, that averages out to $200 a year, roughly. But if you get an MDI for, say, $3,000 at age 50, but it only lasts 8 years on average, you're potentially paying that $3,000 again, maybe 2 or 3 more times over that same 25-year period.
That calculation is exactly the kind of thinking the listener needs to do. It's spot on. While that initial cost is lower and very appealing, the potential need for repeat replacement procedures down the line could make the total lifetime cost similar, maybe even higher, than just investing in the conventional implant up front. And beyond just cost, we also need to talk about the risk of them loosening over time.
Wait, loosening. If the post is smaller and maybe more prone to slight movement, does that cause other problems besides just failing? Like, could it damage the bone or tissue around it?
Yes, unfortunately, that's a real concern. Even tiny microscopic movements over time can lead to inflammation around the implant, what we call peri-implant inflammation.
Right.
And that inflammation can increase the risk of infection and actually speed up bone loss around the implant itself. The bottom line is it's generally more prone to movement or wear over the years compared to a thicker full-size post that gets a really solid grip and more bone. And we should probably circle back to the bone loss limitation again, just to be clear. MDIs are great for minor bone loss, maybe mild cases, but they aren't a magic bullet if the bone loss is severe. You still need enough good bone for even a mini implant to anchor into reliably. Severe cases will likely still need bone grafting or maybe point towards conventional implants being the better, stronger option.
Okay, that really crystallizes the trade-offs. Mini versus traditional. It sounds like we're comparing maybe a very solid, long-lasting foundation that needs more upfront work and cost, that's traditional implants, versus a more accessible, faster, cheaper solution, but one that needs more careful maintenance and comes with the expectation of potential replacement down the road, that's the MDIs.
That's a perfect way to put it. Traditional implants are like the heavy-duty workhorses. Thicker, stronger, built for the long haul, decades potentially, but they demand good bone, often that graft, and more time. MDIs are the nimble, accessible option. Quicker, less surgery, fantastic for stabilizing dentures or for cases with just mild bone loss.
Right. Now, if someone chooses MDIs, maximizing that 7 to 10 year lifespan you mentioned obviously requires commitment. Given they might be more prone to loosening, what specific maintenance things do patients really need to focus on?
It's basically excellent standard care, maybe turned up a notch. Good oral hygiene is absolutely non-negotiable. Brushing thoroughly twice a day, daily flossing, especially around the implant post, maybe using special tools like water flossers or tiny interdental brushes if prescribed.
Okay.
Regular dental checkups are also vital, perhaps even more frequent than standard cleanings. The dentist needs to monitor for any early signs of inflammation or loosening, and crucially, lifestyle adjustments. Avoiding really hard, crunchy, or super sticky foods that put sideways or excessive force on those smaller posts. That's really important for longevity.
Makes sense. Okay, one last potential concern people research, the failure rate. How does it compare?
Yeah, the sources do acknowledge this. The failure rate for mini implants is generally considered slightly higher than for traditional implants. It mostly comes down to that smaller size and the inherent limits on their strength if they encounter unexpected heavy biting forces. This really highlights just how important proper patient selection is. Choosing the right candidate for MDIs is key.
So it's not the right solution for everyone or every situation.
Definitely not. And that underscores the importance of the dentist's experience. You want someone who truly understands the nuances, knows when an MDI is appropriate, and can place them skillfully to minimize risks like loosening, infection, or even fracture under too much pressure.
Excellent point. Okay, that brings us neatly to the provider mentioned in the source material you reviewed. Let's ground this technical chat in a specific place. If a listener is in that area and thinking about these options, who are we talking about?
Right, so the source material points to Omni Dental and Medspa. They're located in Arlington Heights, Illinois. The specific address mentioned is 305E Rand Road.
And it's worth mentioning their service area too, right? Looks like they serve quite a few nearby communities. Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, and Elk Grove Village. So these kinds of advanced treatments are accessible to people across that whole region of Illinois.
Exactly. And the practice leader is Dr. Belis Poles, DDS. The notes mention he has over a decade of experience covering general, cosmetic, and preventive dentistry. And critically, because the practice offers both mini implants and traditional implants, plus related procedures like all-on-4 and bone grafting.
Ah, so they can offer advice based on the patient's actual needs, not just push one specific product.
That's the idea. They should be well-positioned to give truly impartial advice tailored to the patient's specific bone situation, their goals for how long they want the solution to last, and their budget, not just defaulting to the quickest option.
And that Medspa part of the name, Omni Dental and Medspa, that's interesting too. It suggests they do more than just teeth.
It does seem that way. It indicates a broader scope. They handle the advanced dental treatments we've been discussing, but they also integrate aesthetic services. Things like injectables, Botox, fillers, and also specialized skin treatments like hydrofacials, laser therapies, even body sculpting are mentioned.
So a comprehensive approach, looking at the whole picture of smile, health, and overall facial aesthetics.
Yeah, it points towards a model where they understand that restoring a smile and boosting confidence often involves more than just the teeth themselves. It's about overall well-being and appearance.
Okay, that makes sense. Having all those services under one roof, from potential grafting to the implants themselves to the final aesthetic touches, seems like a benefit for the patient journey. All right, so to wrap up this deep dive, we've established that mini dental implants, MDIs, offer this really valuable practical option, especially good for stabilizing dentures, often avoiding bone grafts, and they bring speed and affordability to the table.
Exactly. And that brings us right back to that final thought, that provocative question for you, the listener, to really mull over as you consider your options. You now understand the core trade-off, the convenience versus the longevity. Since NDIs typically last in that 7 to 10-year range, the real question isn't just, how much do I save today? It's, am I prepared for the long-term commitment? Does that initial lower cost balance out against the likelihood of needing replacement procedures down the road, maybe multiple times? Or does the higher upfront investment in traditional implants, which offer that potential for decades of trouble-free function, actually represent better long-term value for your specific life plan and priorities?
A critical calculation indeed, something everyone needs to weigh carefully for themselves. Hopefully this distilled knowledge helps you ask better questions and make the most informed decision possible for your long-term oral health. We'll see you on the next Deep Dive.